We know that spring is the time of growth, right? The plants start to green up, the flowers break through the soil. But it's also the season when trees, grasses, weeds, they all release pollen, sparking big issues for those with allergies or worse yet, asthma. From Mount Carmel Health System today, I'm happy to welcome back Dr. Inderpal Thethi to share some helpful advice for managing your symptoms. And we were just discussing, it's like everybody kind of gets a little of it, right? When spring hits and you're starting to sniffle and feel the allergies.
Absolutely. Everybody's sniffling, everybody's coughing, the red itchy eyes. It can be bad.
It can be bad. All right. So we're talking asthma, and especially this time of year. But what exactly is happening when someone struggles with asthma?
So asthma is a chronic lung disease that's characterized by inflammation and then narrowing on the inside of your lungs, just making it difficult to breathe. Astonishingly, nearly 25 million Americans are living with asthma on a daily basis. And their symptoms can get worse in the springtime because, as you know, their symptoms are triggered by seasonal allergies, mold, dust, and pollen.
Okay, so yeah, it definitely is something where even if you have asthma all year, springtime it can be compounded. You're dealing with even more issues, right?
Absolutely, yes.
Okay, so and the symptoms that people have that might indicate that, because it can be a struggle, I think, sometimes, especially when you're trying to differentiate, right? Do I need my inhaler? Do I need a Zyrtec? Like, what is the difference between what's going on? Is there a simple answer for that?
There's a lot of symptoms that are common to asthma, and they can include wheezing, shortness of breath, chest tightness, a cough, particularly a persistent cough that might be worse in the morning and maybe worse at night, maybe bedtime, difficulty sleeping, definitely increased mucus production, and then fatigue.
Okay, now is there something that people who struggle with asthma, they do have to get an actual diagnosis for that, right? That isn't something they're going to go over the counter and say, I think I have this, give me something to help.
Yeah, absolutely. You should definitely seek advice from a medical professional, go to your doctor, get the proper workup, and then get the right treatment plan. Absolutely.
Okay.
And then for most patients, a right treatment plan will include taking daily medications to help control their symptoms. And these medicines may include pills, inhalers, or even shots.
And so you mentioned all of these symptoms too. If you are experiencing these symptoms, are there things that you can do yourself? Maybe you're waiting, right, to go see a professional to kind of lessen the severity of some of those?
Yeah, you can take over-the-counter medications such as antihistamines, nasal sprays that contain steroids like a Flonase or a Nasonex. But I honestly advise that if you're having urgent symptoms, like such as a severe asthma attack or difficulty breathing, call 911 or go straight to the ER if you're able. For non-urgent symptoms, definitely talk to your doctor about getting the right workup and the right treatment plan. Really understanding your medications and taking them properly can lead to successful management of your symptoms.
And you mentioned that because it can seem complex, I'll say, for some folks when it comes to taking, whatever the treatment plan may be. So what is the real importance of, taking it every day, of knowing that this is what I need to do to lessen the severity?
Yeah, I mean, understanding what you're taking is very, very important, which will lead to, making sure that you take it on an everyday basis to control your symptoms. Astonishingly, up to 90% of patients are thought to use their inhaler with the improper technique, limiting its effectiveness.
Okay, and that's interesting. I know that my son takes it, and he has what you tell me what the proper name is for it, the tube that kind of helps you take it a little bit better as you're squeezing the inhaler.
Yeah, it's called the aero chamber.
Yes, the aero chamber, yeah. So, knowing that too probably depends on the age of the patient, whether that's going to be beneficial.
Absolutely.
Okay.
Devices like that can really help deliver the medication deep into your lung, especially if you're at a younger age.
Okay, all right, perfect. So environmental changes as well. Are there ways that people can limit their exposure perhaps?
Yeah, absolutely. Knowing what you're allergic to and avoiding it is fundamental. Symptoms can be triggered by things like weather change, animal dander, colognes, perfumes, and even detergents. For indoor allergens, simply try to avoid what you're allergic to, what your triggers are. Now, avoiding the outside stuff, the external triggers, may be more challenging, but there are ways to help overcome that and to lessen your symptoms, such as turning on the air conditioning in your car or your home and not opening the window, or washing your hair and clothes immediately after you come back from outside, or even using a nasal irrigation to wash your nasal passages to help you breathe better. Some simple techniques that may help manage your symptoms. If you're going outside, I recommend watching the air quality index or even the pollen counts on your phone and adjusting your activities accordingly.
Yeah, absolutely. All right, if somebody does not have an allergy, an asthma doctor, I know Mount Carmel, there's a simple way to do that. If you go to mountcarmelhealth.com, you can just search under Find a Doctor. And as you mentioned, if you're having symptoms, get in as soon as possible, because I know it can also be very dangerous, right, when you aren't being treated.
Yeah, absolutely. It can be dangerous, it can be suffocating. It's just an awful feeling when you don't have the right treatment.
All right, but there is a treatment out there. So, doctor, thank you so much.
Thank you for having me.